College Student News Network. Welcome to the Health Center Update. The CDC has reported a shocking number of pneumonia cases here in the northern Nevada region. We have here Dr. Alveoli, who's going to tell us about what pneumonia is.
Thank you, Francesca. As you're aware, pneumonia is a very serious acute infection of the lung tissue, and I'm so happy you're taking this opportunity to bring this to light. It can be caused by a number of microorganisms, including Staph aureus, Pseudomonas aeruginosa, and most commonly, Streptococcus pneumoniae. Pneumonia can occur either as a primary infection or by one of the many viral infections that are going around our community at this time. Some of the common viral infections that can lead to pneumonia are respiratory syncytial virus, parainfluenza, adenovirus, and the rhinovirus, otherwise known as the common cold. What happens is bacteria enters the lung tissue via the upper respiratory tract, and it creates an inflammatory response characterized by increased blood flow and increased capillary permeability at the site of the initial infection. The inflammatory response to the pathogen eventually leads to fluid buildup between the capillary and alveoli and increases the distance over which oxygen and carbon dioxide must diffuse, thereby decreasing the rate of gas diffusion. Since oxygen is less soluble than the carbon dioxide, its movement into the blood is most affected, often leading to a decrease in hemoglobin oxygen saturation, which is one of the clinical manifestations of pneumonia. Another clinical manifestation is crackles or a bubbling upon auscultation of the lungs. This is what your clinical provider will do when you go see the doctor. Also, pneumonia can manifest as pain in the pleural cavity. That's a result of pressure in the lungs caused by fluid buildup. Okay, so pneumonia can be classified as a community-acquired pneumonia or hospital-acquired pneumonia. It is classified as community-acquired pneumonia when it is outside the healthcare facility or in an individual that is not a healthcare worker. In addition, infection from community-acquired pneumonia is generally caused by strep. In contrast, hospital-acquired pneumonia occurs after 48 hours of admission into a hospital facility. It also can be caused by any number of organisms that live in the hospital environment. So transmission of community-acquired pneumonia is by aspiration or inhalation of the bacteria. In other words, an infected individual coughs or sneezes near you and you can get pneumonia.
Thank you, Dr. Alveoli, for that informative explanation. This is not an infection you want to get. We have Heather Hacker here, who's going to tell us what signs and symptoms to look for this infection.
Heather Hacker coming to you live from Carrington College Student News Network. Today we're going to be talking about pneumonia and the signs and symptoms that present with pneumonia and how you can prevent yourself from coming down with pneumonia. So first we're going to talk about the signs and symptoms. One, you're going to have a hacking cough with possibly with some phlegm. That phlegm may be yellow, green, or brown and may have pus in it. You may also have a fever, is it hot in here? Of greater than 104 degrees Fahrenheit with chills. You may have difficulty breathing. Your respirations are going to be rapid and labored, and you may have wheezing. You're going to be really tired and have activity intolerance, body aches, loss of appetite, and may have sharp or stabbing chest pain. Some people have had sweats, night sweats, and the elderly population can present with confusion. If you know anybody who may have these symptoms, have them contact their primary care provider. Also, children and the elderly may present with blue fingernails or blue lips from the lack of oxygen. So, excuse me. So, once you have been diagnosed with pneumonia, here are some things that you can do to limit the progression of pneumonia at home. First thing you should do is stop smoking. That is one of the biggest ways that you can get pneumonia is by increasing that bacteria in your lungs. So you want to stop smoking as soon as you can. You contact your healthcare provider on smoking cessation and how to find resources for that. Second, you're going to want to protect yourself and others by hand washing before and after meals and after you use the restroom. A great way to prevent pneumonia and limit the progression is to do breathing exercises daily, or if you have an incentive spirometer, that will help increase the capacity of your lung volume and decrease the complications from atelectasis, which is the collapsing of the alveoli in your lungs. Next, you're going to want to perform good oral hygiene by brushing your teeth and using mouthwash at least twice a day. Try to maintain a well-balanced diet and adequate fluid intake. That will help loosen the secretions in your lungs. If you have a cough into your elbow and not your hand. That will help prevent you from passing on those germs to other people. Ways to increase your health: get enough sleep, exercise regularly, and avoid overly crowded areas to prevent contaminations from germs that can lead to pneumonia. Also, you want to stay away from people who have known upper respiratory infections, as that will also help you stay healthy during this time of year. You want to complete all of your antibiotics as directed by your physician and seek medical attention if you're not getting better within 7 days. One of the big things you can do is get your yearly influenza vaccine and pneumococcal vaccine if you are younger than 5 years old or greater than 65 years old. If you are immunocompromised, for example, if you live with HIV or AIDS, have any cancer, if you use corticosteroids, have kidney disease or failure, heart disease or failure, or if you are a smoker or an asthmatic, it is important that you get vaccinated to prevent influenza, to prevent further complications like pneumonia, avoid large crowded areas, and stay away from people who have infections.
Thank you, Heather. So this sounds like it can be very serious. I also have Samantha with us, who's going to tell us more about how this can be treated.
Hi, I'm Samantha, and today I'm going to talk to you about treatment of bacterial pneumonia. Treating bacterial pneumonia is usually done empirically with antibiotics such as macrolides or beta-lactams or fluoroquinolones. Obviously, we would prefer to do cultures and sensitivities, but delaying the treatment for these people is just not really what we want to do. These antibiotics are all to fight the infection of pneumonia, but they do so in different ways. Macrolides like erythromycin, azithromycin, they all work by inhibiting protein synthesis by binding to the 50S subunit on the bacterial ribosome. This messes with the bacteria reading the messenger RNA and therefore making defective proteins. Beta-lactams, such as tazobactam, inhibit the bacterial cell wall. They block the enzyme that does the cross-linking of the peptide chains. So this will make the cell wall kind of leak, and it will also lose its structural stability. There's also drugs like fluoroquinolones, which are like levofloxacin and moxifloxacin, which inhibit nucleic acid synthesis by inhibiting DNA gyrase. DNA gyrase will pack and unpack the supercoiled DNA. If a patient is hospitalized with bacterial pneumonia, we're able to check the therapeutic response of antibiotics by checking white blood cells or seeing how their signs and symptoms are responding. These people can also be put on supportive treatments such as oxygen, hydration, antipyretics for their fever, and also rest. All of these treatments depend on the offending microbes as well as how the patient is responding to the infection. Because of empiric treatment, a lot of strains of pneumonia are becoming multi-drug resistant, but with the problem of awaiting results for culture and sensitivity, this can be life-threatening. So we're kind of in between a rock and a hard place on that one. Care plans for these patients are obviously individualized to them. The patients should start to see an improvement with antibiotic therapy within a couple weeks. They can be put on pain medicines as well as steroids to help out with any symptoms as well. Obviously, we just work with the patient until they continue to improve with this acute infection.
Well, it sounds like with the right treatment, the infection can be resolved. Remember, good hand hygiene. This means washing your hands with warm water and soap for at least 30 seconds. If soap and water are not available to you, make sure you use an alcohol-based hand sanitizer to clean your hands. Parents with small children or people over the age of 65, and also those who are immunocompromised, need to avoid crowded areas. So this year, make your New Year's resolution to keep yourself and your family healthy. Thank you for watching the Health Center Update, brought to you by Carrington College Student News.